myself, but I've been working in the field of drug research, both in my own country, in the Netherlands, and internationally. Did a lot of work also in developing harm reduction interventions in the former Soviet Union and Eastern Europe for quite some years. So, and now I'm here to guide you through this day. The research reported yesterday formed the basis for one of the most important tasks of the EPPIC project, which is the development of quality standards targeting practitioners working with young people in the prison system. And I think yesterday we've heard a number of really nice presentations. For me, there was a lot of, how do I say that, findings that were reported that suggest to me, if I have to make a very quick conclusion, that if we are talking with young people about, you know, drug issues basically, or in drug treatment more generally, I think the drug is probably the issue we should talk about the least. We should focus much more on the whole set of circumstances, both social circumstances and, you know, people's psychological status, for example. I think the story of trauma that often, you know, locks people into problematic drug use. So those are the issues I think that need to be addressed much more often. So the quality standards presented today are based on other sets of quality standards developed at international and national levels. There's quite a few developed in the EU. And in particular, the standards are linked to the European Drug Prevention Quality Standards, which provide a set of principles to help develop and assess the quality of drug prevention and offer a comprehensive resource outlining all the elements of drug prevention activities. So the task of this project was to make the EPPIQS, that's the abbreviation, specific to practitioners working with drug-experienced young people in the criminal justice system, to try to do this in a succinct and accessible manner. Well, I think I've gone through the standards. That certainly you did very well. It's a very clear and concise document, I think. So, I would like to introduce Heino Steuver. I hope I pronounced it well. Heino is the German team leader, a social scientist, and professor of socio-scientific addiction research at the Frankfurt University of Applied Science in Germany. There's a whole list under there, which I will skip now. And if you'd like, you can tell a bit more about yourself. I assume you're presenting together, aren't you?
Yeah, we do.
Okay. Now, then let me tell you that Babak is at this point doing his PhD in public health at Heidelberg Institute of Global Health. I give you the word, gentlemen.
Thanks a lot, Jean-Paul. Yeah, can you hear me in the back? Fine, good. Yesterday I've got some difficulties in understanding people, but now I'm trying to be loud and clear and so on. So we are presenting, Babak and me, the quality standards for interventions aimed at drug-experienced young people in contact with the criminal justice system. We are presenting that on behalf of all EPPIC partners, because it was collaborative work. You remember there were some hundreds emails going on throughout Europe, and we were, let's say, working on the final version of it. As Jean-Paul pointed out already, the whole work is not starting from the scratch. We built this work on the European Drug Prevention Quality Standards from the EMCDDA in Lisbon. Again, that is the baseline where we start from, and we built all these standards on these issues. We thought in the beginning whether it makes sense to have another set of standards at all. But it was written in the application, so we had to do it. There was no chance, no alternative to that. And we thought in the beginning that Europe needs everything, but not another set of standards. There's a lot of standards already existing. And why don't we make use of those existing, these European drug prevention quality standards, for instance, and other general standards. However, we thought that looking a little bit into literature, we didn't find anything similar. So at least we thought then in the end it is assisting practitioners working with young people to improve the quality of their interventions they are planning or already conducting, whether in prison or in community. So we are focusing on young people that in one way or the other do have contact with the CJS and need some assistance to get a better well-being. So we are helping practitioners and to obtain safe, effective interventions and positive experiences, helping them to manage and reduce drug use and improve well-being. The standards, as all standards, do not make sense if they're only written in English. So we decided to translate it into German, so no German prison practitioner would ever read or follow even English written standards. Sorry, that's the reality. So we will translate it into German, and we ask everybody of the partner of EPPIC to translate it in their languages, which indeed then makes sense in terms of dissemination and transferability. How did we get to these standards? We conducted interviews with young people and professionals within this EPPIC project. We analyzed that and tried to include their perspectives on principles of good practice. Yesterday we've heard of participative research or the value and the impact of participation in general, and we try to make it very concrete to get their perspectives integrated as well. We identified important other standards and tools, content analysis of relevant guidelines we did on quality standards, and then a draft version of this handbook was reviewed and commented upon by all EPPIC collaborators to make sure that the handbook fulfills the EPPIC objectives. And finally, the pre-final draft was subsequently field tested in national expert consultations in each EPPIC partners, was adjusted to country-specific needs and consultations with experts and from relevant international organizations as well to consider their suggestions inside these standards as well. So that's how we worked on that. I underestimated a little bit the impact of the work included in these standards. So in the beginning I thought, okay, it's quite doable, but it turned out to be quite tricky when we worked on different views of EPPIC partners and also from practitioners. So it was quite an ambitious work. And now Babak will present the quality standards.
Thank you so much, Heino. Thank you. I would like to thank all the EPPIC partners. As Heino said, that was a collaborative work and preparation of these quality standards. It was not possible without the helps of all the EPPIC partners. I just want to elaborate a little bit the process of developing these quality standards first, and then to go through the standards in detail. Well, first, as a first step, we interviewed a number of young people in contact with criminal justice system, as well as some practitioners and policymakers in this field, to collect their perspectives about experience of good practice. Then afterwards, we also reviewed the literature to find all relevant documents such as guidelines and the quality standards and so on, focusing on publications from global databases like UNODC, for example, EMCDDA, and the other databases. After preparation of the first draft, we circulated that among all EPPIC partners, as well as 2 external experts in this field from EMCDDA. We got feedbacks, a lot of comments and corrections, and we revised the first draft, the first draft of the text many times. We circulated that again, at this time to more external reviewers and collaborators. We got their feedbacks and we finalized the text. Then we prepared the first draft of the handbooks with a professional layout design. We circulated that again among the partners. We collected their thoughts and we revised that. And what you have at the moment, what you see at the moment is results of at least 1 year full work. Yeah, that was a brief process of providing these quality standards. But what are these quality standards? What have we produced? The first quality standard says interventions targeting drug use among young people in contact with criminal justice system are evidence-informed and assessed for effectiveness. We believe that to provide high-quality interventions, we need to first consider the ideas of the target populations first, and then we need to apply evidence-based interventions. Otherwise, we won't expect any effective results. And of course, the expected outcome of this quality standard would be benefits to the young person by reducing exposure to ineffective interventions, benefits to the agencies and services, for example, by providing value for money and ensuring sustainability of services and projects, and to the society by reduction harmful effects of drug use and criminal activities. The second quality standard is governing the structures and processes are in place to ensure delivery of high-quality interventions. Of course, all of us know that without putting in place structures and processes to ensure evidence-informed practices, the interventions won't be complete. The expected outcome of this standard would be sustainable high-quality interventions adopted as needed to change. And the third standard, screening and assessment for drug use among young people in contact with criminal justice system is undertaken as part of a comprehensive assessment. And first, we need to take this into consideration that it's not only the drug use, we need to take into account all consequences of drug use if we want to have an effective intervention to mitigate the burden of drug use in this target population. And the expected outcome would be improved provision of appropriate forms of support for reducing and managing drug use and associated harms and increasing well-being. The fourth quality standards use people multiple vulnerabilities and complex needs are at the center of interventions and are effectively addressed. Well, again, what we should take into account is that apart from the intervention itself, we practitioners need to focus on the strength of these target populations. And without that, again, that won't be possible to expect any effectiveness. And the expected outcome would be young people will build self-esteem and resilience and be empowered. The next quality standards, an appropriate bundle of intervention options is programmed. And again, there is an overlap between this one and I think the third quality standard. As we mentioned previously, it's not only the drug use itself. We need to take into account that those who use drugs, they are more likely to engage in other high-risk behaviors. Those who inject drugs, for example, are more likely to have, or those who use drugs are more likely to have unprotected sex and to acquire sexually transmitted infections and so on. Yeah, in this regard, WHO has defined a term. It's called combination interventions. If we really plan to mitigate the burden of a disease or disorder, in this case drug use, then we need to focus on various aspects of that. Not only one intervention would be enough to address this issue per se. The expected outcome for this quality standard is better coordination between service sectors and better links between secure and community settings, providing improved choice for young people. Continuity of care within and between services and community interventions is ensured. That's very important because if there is no coordination between the interventions, for example, well, the young people, they won't engage, and we cannot expect any effectiveness in this field, in this regard. Expected outcome of this quality standard would be greater collaboration and links between services and community sectors and improved continuity of care. The second quality standard, which is one of the key quality standards here, young people's participation in designing and implementing an intervention is promoted and ensured as far as possible as every stage of interventions. Yes, I think this quality standard doesn't need further explanation. We need to engage people. We need to have them on board if we want to. Sorry.
5 minutes.
Yeah. Yeah. If we see effectiveness for our intervention, and the expected outcome would be improved engagement with services, interventions, and ownership of care. Another key quality standard, equity and non-discrimination are ensured within interventions targeting drug use among young people in contact with criminal justice system. Well, we believe that without interventions, they needed to be offered to the target community, to the target populations. In this case, to the young people who are in contact with criminal justice system and who are drug experienced. These interventions needed to be regardless of their gender, age, education level, minority, and sexual orientation, and so on. It's very important. As an example, in a prison context, for example, role of gender, chronically, more attention has been paid to men compared to women in the prison context. And I personally believe that it's because of the number of men in prison who are much more compared to women. But on the other hand, evidence shows that women are more likely to engage in high-risk and I would say not only high-risk behaviors, problematic high-risk behaviors. It means that I would say, for example, prevalence of injection of problematic injection drug use among women who use drugs in prisons is much higher than it appears in male prisons. Nice quality standards says practitioners demonstrate professional competence. Yeah, that's obvious. Apart from their professional training and experience, they need to know that these people, these young people in contact with criminal justice system, they have their special needs, and they needed to be treated as people with these special needs, and they need to be treated differently. And the expected outcome would be development and continuous improvement of workforce capabilities and responses to the needs of drug experienced young people in contact with criminal justice system. And 10th, and the last quality standard is practitioners respect ethical principles and professional codes of practice. Of course, in all interventions, codes of practice and ethical aspects need to be taken into consideration. Otherwise, the intervention won't complete. The expected outcome for this quality standard would be interventions and services that respect human rights and the law. And very briefly, do I have a couple of 2 minutes? Okay. Well, these quality standards are not developed to say what to do. These are developed to help the practitioners about how to do, about how to implement the interventions. And regarding the first question, how to design an intervention, how to implement, and so on, the European Drug Prevention Quality Standards, EPPIC is a very nice and evidence-based document which can help the policymakers and also practitioners to design the interventions. There are many aspects mentioned over there. It's study designing, needs assessment, resource assessment, and monitoring, evaluation, and so on. But these quality standards, they are here to address how to implement the interventions. And to this end, some points need to be taken into account. The first one is that, of course, prevention interventions within criminal justice system is not easy, and the practitioners would face a lot of problems. One of them, for example, would be if two similar interventions are in place but with different source of fundings. That would be very difficult, but also a challenge for a practitioner to maximize the effectiveness of these two interventions. The other point is that cooperation between partners may be hindered when organizations are not legally allowed to share data and information about clients. And next one, ensuring a smooth transition between agency services.
This means that your time is about over.
Okay, 30 seconds. Partly because of information sharing and cooperation problems, interventions are of varying length. Many practitioners felt that although short temporary interventions might benefit some young people, and much longer support was needed. And the last point is that knowledge about quality standards and experience of using quality standards is not widely found among practitioners. It's up to us to disseminate the knowledge about that. And yeah, as we said, more information about the quality standards and about this presentation you can find in the Handbook of Quality Standards. I think all of you have one copy of this, and if not, you can take it from the over there.
The back, yes. And there's extra copies if people want to take them back to
And-
their services.
Yeah, and if you want extra copies, then they are available and you can get them. And thank you so much for your attention.
Well, thank you very much. If I understand it right, we have two commenters now, and one of them is on the screen.
Yes, that's
Okay.
right. Yeah, it's
Good.
Mary.
So we have Harry Sumlow in the room. There's Harry. Please come out.
It's Marika who goes first.
Sorry?
Sorry, who's going first, myself or
I
Marika?
think we're going to try to get the link with Maria America set up first. If that's okay.
So shall I get
It's
my
three
camera?
people.
I think she goes first. Is that okay?
Anyway, you've just been doing the work by
Three
it.
Oh, sorry. Yeah.
Yeah.
Yeah. I'm a little excusez-moi. So,
I wouldn't have liked you.
are you going to come in front here, you guys?
I'm going to sit here so I can watch the screen.
Of course, yeah. Okay, good. Before we get into the comments, I have two small notes that Betsy asked me to tell you and make sure that you will act on that. That is to fill out the evaluation form at the end of this meeting and put it in the box at the back. That's the one thing. And in the coffee break, the teams of the project should stay here in the room for photographs. So please don't forget. So we're now going to come over then to, Guy Ubi from CGL, but maybe you can explain in like half a minute what you're doing. And if you can do the same, and maybe Marika can do that as well. Can you hear us, Marika?
She's not Marika.
Oh, that's not her, that's you. Oh, God. So, I need a little guidance. Are we waiting or are we just going to begin?
Well,
Another question.
how near are you to getting Marika?
She's just not, she sent me the link, but she's not joined her
But she's
link.
not joined. Maybe we should have one first then. Harry makes no sense.
I'm just sending her an email.
Sending her an email.
Zoom, 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 zoom. Tree. Mhm.
From Maria,
Would it be sense to email Marika and ask her to do later and then Harry can put his needs?
I can call her.
Yeah, it's
Yeah,
email
email,
it and
yeah,
say a
Franca,
little
can you-
later. Harry, it makes sense for you to start.
we're just trying to do Zoom or do Skype, but they don't seem to be wanting either. Tried to add them and start to add Lou, but it's not there. But the email.
Nice to see you again. I used the microphone now.
flexible.
There she is.
Hi.
Hello, Marika. Can you hear us?
Yes, very good.
Yeah. And I think we can hear you, but we need a little bit more volume, I think. So who's starting now?
Can you hear us?
Yes, I can.
Oh, wonderful. Okay, you're projected on our screen to a plentiful room.
Okay.
You might not be able to see us because the camera is this way, unfortunately, but we can definitely see you. So thanks
Yeah.
again.
If you want to begin, American, if you could use quite a loud voice because we've got the volume up.
It's hardly. Can you hear that?
Heino's spoken. Heino and Vibeke have spoken, so the quality standards have been presented.
Okay.
Yeah.
Because I was following the live stream, and it's not in contemporary.
Okay.
So it's my turn.
It's your turn, yeah.
Okay, I try.
But you need to connect this to the sound system. That's the problem here. Because nobody's here.
If we can just, sorry, America, if you could just wait, we're getting the technology guy back to get the sound up a little bit.
It's my turn.
Brian just came and he left. Is there any way you can come back just to sort out the volume? We've done the Skype call, we just need the volume.
Yeah, you need to connect the computer.
Can you hear me if I speak at this corner?
No, not with the
We're struggling to
Try
hear.
something else. Where's the speaker of this thing? Where's the speaker?
We've already got it up as
Yes. Yes. Can you?
Does this help?
Yeah.
Can you say something?
Sing a song.
Can you hear me?
Very softly.
Can you take the mic? She should put the mic closer to her mouth.
The suggestion from the room here is to put the mic immediately in front of your mouth.
Okay, to keep the mic closer to my
Well,
mouth.
in the end, I don't think that's not the problem. We need a connection here between the computer and the sound system. That's the issue.
Yeah.
If people come to the front, they will be able to hear, because I can hear. So if people all came to the front.
Yeah, well, the suggestion here that you all move to the front of the room, that then you don't, well, there's a big screen.
Just for this session, just come and stand at the front. If people just come and stand closer.
Yeah, I'm fine with that.
Okay, come forward if you want to hear, come and stand. If you can't hear, come forward. Because it's possible to hear when you're here. You can hear. Okay, I would go ahead, I would start, Karen.
Okay. Yeah. And if we could just ask her to use a big voice, yeah.
Okay, well, we're going to try it anyway. So the standards have been presented. If you can spend 30 seconds on introducing yourself, and after that concentrate on the standards, please. We need a cable between the computer and the sound system.
Can you see my screen?
We can just see you, America. We can't see the screen.
They can only see me, not the screen.
Marika, can you keep talking?
Yes. It was a better see the slide, but I'll try to speak anyway. So, just to introduce myself,
Could we ask Marika to be available a little later? And
I think we lost you, Marika.
The Zoom call, you just put the call on hold. You look at the yellow bar at the bottom of the screen.
Yeah.
Resume call.
Intervention.
Okay, you now have sound, but we've missed a little bit of your response, so if you can, you know...
I can start again.
Great.
Okay.
She hasn't shared her screen with us.
Okay, you still need to share your screen as well.
Yeah, we are trying. They'd like to have the screen shared. Okay. While I wait for my kind colleague trying to share the screen, I will start back again introducing myself. Interrupt me if this is not what you want to do. So, my name is Marika Ferri, and I work at the European Monitoring Center for Drugs and Drug Addiction here in Lisbon. It was not possible for me to travel to London, so I'm trying to do my best to be present anyway. This is a project that is definitely in line with the objectives of my work here. That is promoting evidence-based interventions and their tools like standards and guidelines. For this reason, we have been involved from the very beginning in the steering group of this project. I would take the opportunity to say hello to all the friends that are there today. I heard Cynthia's voice. I guess Harry is there, Betsy and Karen, Heino. So I really wanted to be there with you. Talking about my intervention, upon a request by Betsy, I had a look at the standards. I took very detailed note. If I can't see my okay. Just a very brief reference to previously existing standards. I could heard Heino saying that these standards were inspired by the European prevention quality standards. In fact, as far as I know, they have been the first big endeavor supported by the European Union. And I don't know if, can you now see my presentation?
No,
not yet. They cannot. Can you hear me?
Yeah, very well.
Okay, good. So it was the first efforts carried out by Harry and his team, and it designed the type of process that people can follow in order to rationally diagnose a problem, select the type of intervention they want to carry on, take into consideration the target. So these standards really set the foundations of this type of work. For this reason, they have been, for example, taken on board also by another milestone project that is called ECUS. This project wanted to enlarge the scope of the prevention standards to other areas of interventions in drug demand reduction, namely treatment and harm reduction. The standards by ECUS were a little bit more prescriptive. For this reason, probably were more difficult to implement. Then the European Commission decided to propose a council conclusions on quality standards in 2015. It was a very simplified version of the standards, whose objective was to pick some of the standards from previous projects and to create a set of aspirational statements with which the countries could look towards the same direction, rather than doing the same thing, that is something really impossible in a region like Europe, where we come from different stories and systems. So this is, I think, the background, the general background of the standards we talk about now. Can I go on? Okay. Can you see now the slides?
No.
No.
Not yet. Okay. Okay, you cannot. So what I can say is that standards are becoming more and more popular. For example, in European countries, in their different interpretations of what standards can be. In a very recent survey we did at the MCDA through a data collection system we have that is called workbooks. So it's a kind of a qualitative data collection through which our national focal points, our now 27 national focal points, plus Turkey and plus Norway and Turkey, inform us about their activity in quality assessment. About 80% report the use of some types of guidelines and 60% the use of some types of quality standards. Looking at these quality standards, you recognize that there are huge differences among those countries that have an evidence-based background and those that comes from more top-down approaches where standards are used to control the services rather than spreading the culture of transparency and evidence-based interventions. I think asset of standards, for example, in comparisons with guidelines, is that where guidelines provide detailed recommendations, in general are more common in health, of course, but they provide detailed recommendations based on the most recent update on research, meaning they can change fast 1 year to the other. The standards, to some extent, provide the libraries where each context, each country can put their own contents, provided they are, as I said before, watching the same direction. Respecting human rights for some countries that are more closer to quality level in this sense will mean less efforts than for other countries. So the objective is the same, the efforts you put there is different. This flexibility makes a standard more acceptable towards the countries and also can create on longer term some benchmark and recognize the efforts even when the results are not immediately evident. Just to give an example, up to some years ago, Greece reported to have 7 years waiting list for methadone treatment. What we used to say, in this case, if they decided to diminish by a half their waiting time, they will still have 3.5 years. But the effort they are putting there is huge. So standards will give them a possibility to set their goals, to achieve their results, and to prove the efforts they are doing. Looking at this specific set of standards, the EPPIC standards, I see some characteristics, some peculiarity. They have a very specific target. They are targeted